Good afternoon. I'm Dr. Davison. I'm the medical director of Greenwich Hospital's emergency department. So thank you for joining today. I am going to speak about some unique situations and illnesses and injuries that we see in the emergency department during the winter. I understand that that the guests may be muted, so if you had any questions or comments, please feel free to enter them into the question and answer icon, and I can check that periodically to respond to your questions. So thank you very much for attending this presentation, and I'm happy to jump right in here. So this is our Yale Naval Health Systems vision, mission, and values, which we hold dear and enforce and apply. Just briefly about myself. Again, my name is Dr. Davison. I am a board-certified emergency medicine physician. I went to Albany Medical College and graduated in 2000 from there. And then I went to the University of Pittsburgh, where I did my emergency medicine residency training and graduated in 2003. Originally from just outside Boston. And when I finished my residency training, I looked at places in Connecticut and Massachusetts and stumbled across Greenwich Hospital and started my career here in 2003 and have been here ever since. In 2003, I started as an emergency medicine physician full-time, and around 2009 became the medical director of the department, and again have been here for my entire professional career. I don't know that there's any better place to work. So just a brief overview of Greenwich Hospital's emergency department. We see approximately 38 or 39,000 patients per year in the emergency department. Patients who come to the emergency department, about 75–77% of those patients are evaluated and treated in the emergency department and then discharged for follow-up with their primary care physician or a specialist as needed. And 23, almost a quarter of the patients who show up to the emergency department get evaluated, worked up in the emergency department, and actually admitted to the hospital for further care. We have 23 patient rooms overall, a couple of negative pressure rooms, which has become important during infectious disease pandemics like we are currently in. And we have 4 fast track rooms, which is an area that we would see lower acuity illnesses like ankle sprains or lacerations. And we have a behavioral health unit area, which has 4 rooms. And that is an area where patients who have acute psychiatric illnesses that require inpatient transfer and management get housed until we're able to find them a place for inpatient management. The emergency department is staffed by approximately a dozen full-time board-certified emergency medicine physicians. We work with physician assistants as well, and have a whole cadre of nurses and nursing assistants that work in the emergency department to help us care for our patients. So I'm going to go through some of these topics in terms of winter-associated illnesses and prevention, and these are unique, primarily unique to the winter months, and have some interesting presentations and diagnoses. And I'll go through sort of the things that one can do at home, and some of the things that should require an emergency department evaluation and visit. The first thing I'm going to talk about is frostbite. And the definition of frostbite is it's severe, localized, cold-induced injury due to freezing of tissue. So with frostbite, you actually have areas of your body that are exposed usually to the elements, and they freeze, and you actually develop ice crystals in and around the cells of those tissues that can cause injury, some temporary and some permanent, depending on the degree of the injury and how long one has the injury before seeking treatment. Some terms that also get thrown around are things like frost nip, which is cold-induced localized numbness and tingling that resolves with rewarming. There's no permanent damage with frost nip. That's really common, and that's something where you just kind of go outside in the extreme cold, to grab the newspaper or something without gloves on, and you come back in, and your fingertips might be a little tingly. It can sometimes be uncomfortable as it rewarms, but it's very short-lived, and you move on without any permanent impact. There's also chilblains, which is a localized inflammatory lesions from acute or repetitive cold exposure above the freezing point. So that might be that you come in and out of a very cold environment, and you can have swelling and pain in those areas. What's interesting about frostbite is the way it's graded is very similar to burns. We're all kind of familiar with the terminology of first-degree burn, second-degree burn, third-degree burn. Maybe we don't know what that means exactly, but we at least have heard the terms. And in general, whether it's dealing with burns or with frostbite, it really has to do with the extent of the injury to the skin. How penetrating is the burn, or in this case, the cold exposure, and what tissues are impacted. So if we look at this, and this is kind of a cube or a cross section of skin. So this top layer is what's exposed to the elements with the hair follicles. And then you have your dermis, which is the layer below it. And then you have your subcutaneous tissue. As we talk about degree and level of severity of frostbite, it really has to do with how deep into the tissue it extends. So we just mentioned with frost nip, it really kind of sticks to the upper layer. As you get into superficial frostbite, you can see the cold and the freezing of the tissues gets a little bit deeper, and just gets deeper and deeper as the degree of the exposure worsens. And what you can or cannot see is in this subcutaneous area is where blood vessels live that come up to the surface of the skin, and nerves that come up to the surface of the skin. So as you can imagine, as those areas freeze, you no longer have the ability to get blood to the top layer of skin, and or have the nerves do their job, which would provide functionality like movement and sensation to touch. So as mentioned, with frostbite, you actually have ice crystals that form in and around the cells in the exposed area, and they cause inflammation and damage locally. And again, there's varying degrees similar to the burn description. So the first degree is very superficial. That's where your skin might turn a little white. You go outside for some period of time, you can see that on your fingertips or your cheeks or the tip of your nose. And sometimes you notice it on someone that you're with. They just say, hey, listen, why don't you head back in, or maybe we should go inside and warm up a little bit. The second degree is when you start to develop blisters that generally contain clear fluid, and around that area you're going to have swelling and redness, and that can be delayed in terms of that can develop within 24 hours of the exposure. So you may go out, get that exposure leading to a second degree type of injury. The blisters aren't going to pop up immediately, but over the next several to 24 hours, you can have the development of those clear fluid containing blisters. As the depth of the skin injury gets deeper, you can have the development of blood blisters. Again, that's when the ice crystals and the freezing of the tissue actually gets down to the capillary level, where the blood is being blood flows, which is why it leads to the blood blisters. You can actually get the blackening and the scabbing of skin as well, and I think we've all seen those extreme pictures. I will spare you them now, but I'm sure over the years you've seen the pictures of people who are mountain hikers, or and have extreme cold, and their fingertips or toes really get very, very dark black and then contracted. It's pretty impressive appearing. And then fourth degree frostbite is where the actual damage extends into the muscle and the bone, and you get death of tissue. That is certainly an extreme, and you'd have to be in very cold temperatures and have extended exposure during that time frame. So risk factors. So what is it that puts one at risk for developing frostbite? So basically, it's a balance of the ability for your body to create heat and hold the heat and maintain the heat, it balanced versus the ability for the heat to leave your body and leave you cold. And so certain things, if you're exhausted, malnourished, people who have diabetes, which leads to peripheral vascular disease and damage of the peripheral nerves and capillaries and blood vessels, makes people more prone to frostbite. Mental illness, and such that if one cannot recognize or identify that they are in an environment that may be causing harm and therefore stay in that environment longer than they should. And that also is similar with alcohol abuse and intoxication. If someone loses the ability to maintain cognition and be aware of their surroundings and situation, they may stay in an environment that is unsafe for a protracted period of time. Certainly if someone had so much alcohol where they passed out or lost consciousness, and that was in a cold environment, that could certainly lead to frostbite. Insufficient clothing is probably a big one, and it sounds easy, but basically this is when people are not dressed for the appropriate elements. Maybe their coverage is too light. The other thing that can make you susceptible to frostbite is having damp clothing. So if you're outside, and sweating, even if you're wearing gloves, but you're sweating a lot and your fingers are getting wet, that increases the ability to have the area freeze. And then permeable to wind. So if you're not wearing a shell type of jacket, and so you have wind that can kind of penetrate your sweater or clothes, whatever it is that you're wearing, can certainly lead to frostbite. This is very specific. We see this more in pediatric and elderly folks. So young children who parents are responsible for dressing. We do take ownership of making sure that if our child is going outside, that they have the appropriate dress on. They're extremely dependent on us for that. So it's important that we do that. And then as the kids get a little bit older, they may shed the gloves that we put on them, and the hats and the jackets and the scarves that make them more susceptible to things like frostbite. And then again, what you may see with elderly folks is if they have some form of dementia, Alzheimer's, some sort of cognitive impairment, again, they may be in an environment they're not appreciating the fact that they can be exposed and develop things like frostbite or, as we'll discuss, things like hypothermia. Something else that is not really uncommon is just a prolonged application of ice packs. So if someone sprains their ankle, wrist, has a finger injury, and places an ice pack directly on the skin for prolonged periods of time, that can actually cause frostbite in and of itself. So the recommendation would be to put some type of cloth in between the actual ice pack and the skin to dampen the direct effects of the cold, and then limit that ice pack to 15 to 20-minute intervals and taking breaks to allow the skin to warm up a bit before applying the cold ice pack on it again. So the areas of the body that are most frequently impacted by frostbite are the areas that are exposed. And again, for us who live in the Northeast, this is not going to come as a surprise when you go outside and whether you are or not properly dressed, you certainly feel it in your ears, your nose, your cheeks, your chin, your fingers, and your toes. Those are the areas that generally get exposed and make us susceptible to frostbite. And some of the signs and symptoms is the area may appear cold, feel cold. You might have some numbness to the skin, again, particularly on fingertips, or if you have it on your cheeks and you feel your cheek, it may feel like you have a decreased sensation as compared to normal. The other thing is that the skin may appear white, waxy, you might feel hard, and you may have a little bit of clumsiness or difficulty moving the areas like your fingers as frostbite settles in. And then again, as we discussed, usually not acute, but over the next 1 to 24 hours, you can have the appearance of blisters if you've had prolonged exposure and onset of frostbite. And as we discussed also, the skin discoloration, sort of the white blanching skin to the black areas where you actually start losing tissue and have death of the skin and surrounding areas. The treatment, so again, most of us who've lived in this area will do our periodic checks of one another, and if we're feeling cold, the first thing to do is to remove yourself from that cold environment and get into a warm environment, which usually means, getting back into your house or someone else's house, or just taking a break and removing yourself from the cold environment. As mentioned previously, damp clothes have the ability to increase the risk of frostbite. So if you're outside working hard, shoveling, sledding, and you come in for those warm-up times, you should definitely change your clothes if they're damp and wet, and put dry clothes on before you go back out. If you're concerned about frostbite on your feet, it's advised to stay off your feet. And again, that can just be sitting down and kicking up the feet and warming them up with some warm towels or whatever it takes. But it's believed that if your feet actually have frostbite and you're walking on them, that can lead to additional damage. The other thing is that the extremities, feet, hands, fingers, to rewarm them, you put them in warm water, not hot water. And this is extremely important. Again, as we spoke about, you may have some numbness and tingling on those areas that are affected. So your ability to be aware of the temperature of the water may not be there. So not overly uncommon to have someone have water that's too hot that they submerge their extremities in, and that can actually lead to thermal burns. What I would recommend is, if you're in this situation, if it's one hand that you're worried about, or one finger, or fingers on one hand, use the other hand and fingers to feel the temperature of the water. If it's both hands, then use an area like maybe your forearm or back of your forearm to feel the temperature of that water. And if it's too hot for that area, then it's too hot to submerge your extremities in. And again, just warm water will rewarm, and that can take 15 to 20 minutes. It doesn't take a long period of time. The other thing is that we do pretty frequently is, if our fingers get cold, or any body parts, is you can put your fingers, hands into your armpits, into warm pockets, areas that will warm up those areas. We advise not to rub the area, as it may cause additional damage. Again, remember, you have small little ice particles basically underneath your skin, and if you're rubbing it, that friction may cause increased tissue damage to that local area. It's advised not to use open fires or stoves to rewarm your areas. Again, like we had just discussed, that may be hotter than you anticipate, and you could actually get burns and make the situation much worse than it already is. And then the thawing of the skin, usually it goes through some color changes, and it'll turn red or purple. It'll become softer to the touch. It also may be uncomfortable. I think most of us have had that situation, particularly in your fingertips if you come in, or your feet as they rewarm, because the nerves have basically been kind of put to sleep with the frostbite. As they wake up and get their sensation back, you might have that pins and needles sensation, or burning, or aching. And again, that's usually a very, very short-lived experience. Most of these things that we've discussed can be managed just by at home, doing the things that we mentioned before. People that would really require, emergency department visit would be prolonged extreme exposures, where you see with hikers, where, either it's the pain of the rewarming that's intolerable, that would require some type of medication or intervention, or if you had skin that was turning colors and not returning back to a normalish color with rewarming, those would be reasons to seek medical attention. So prevention, the prevention can be fairly straightforward if you are entering a cold area willingly. Doesn't help if it's unanticipated, like if your car breaks down in a cold area, or if you fell through ice. So generally, just an awareness of the external environmental temperature is extremely important before you do any type of outside activities. Chemical heat packs can be used if you know that you're going to an area that's cold. Not uncommon with people who go out sledding or skating or skiing. You can get the heat packs that fit into your gloves and or boots. Appropriate clothing, water-resistant shoes or boots. Layers of clothing is extremely important, and you want that first layer to really be made of a wicking material that basically takes the sweat and the water off of the body, and then have an insulating layer like fleece or wool for warmth. And then again, a protective layer that would block and not allow wind, snow, rain to penetrate. And then again, if it's anticipated exposure, just make sure that you are taking frequent rewarming breaks. And you know, that time can be determined based on how cold it is and what your protection is. But if you're out sledding, you know, again, whether it's 15 to 20 minutes because it's sub-zero, or every hour, something just to come in and again dry off, get rid of the wet clothing and warm up. You know, this is these skiers here. Obviously, they are underdressed for the elements and may have alcohol on board, all things that could lead to what we'll next talk about, which is hypothermia. So again, the key is just be prepared, have the appropriate clothes on and protection. And again, specifically if you have children, to make sure that they are appropriately dressed and not running outside to sled or have a snowball fight in inappropriate clothing for the environment. So hypothermia is a nice way to follow up frostbite. And hypothermia is when your core body temperature falls below 95 degrees. And if you're talking about sort of a normal temperature of around 98.5 degrees, that's only a 3 degree temperature difference. So it's not a huge temperature difference. And there are different degrees of hypothermia based upon what your core temperature is. And depending on what your core temperature is going to determine the signs and symptoms that one has. So just looking at this chart below, you start getting to mild hypothermia when your core body temperature reaches that 90 to 95 degree Fahrenheit temperature. People whose core temperature drops that level, they're generally alert, they're generally shivering. Shivering creates body heat, and if you have sweaters or layered clothing on, your body is able to maintain that heat to try to warm itself up. Not overly helpful if you do not have appropriate covering on, as you will generate the heat, but it will be lost immediately to the environment. And you can also get into the ability of people getting confused or starting to lack the ability to recognize that they're getting into danger zones, which is a problem because they may not have the insight to remove themselves from those elements. With moderate hypothermia, when you get down to 82 to 90 degrees, you really can start to have an altered level of consciousness, such that you could actually become unconscious and your body loses the ability to shiver. And so one of the main mechanisms of your body generating its body heat to try to preserve its normal temperature, you start to lose that functionality. And then again, certainly unconsciousness in the cold environment would be potentially disastrous if no one was around to recognize and find you. And then again, even if you don't lose consciousness, but you've lost the wherewithal to have the sense to remove yourself from that environment or seek help, can all lead to sort of a downward spiral and leading to severe hypothermia, in which case the patient becomes unconscious, there's no shivering, and again, if not found or intervened on within a pretty short period of time, could ultimately lead to death. And again, as discussed, it's all about the balance of your ability to create and generate heat and maintain the heat or lose it to the environment. And most of most cases of hypothermia are accidental. And again, environments where people did not anticipate being in that cold environment for as long as they were, not anticipating that it was going to be as cold as it was, or again, whether they're out hiking and get lost or have an accident on an ATV vehicle or whatever it is. Again, mostly accidental. People find themselves in an environment that they did not anticipate and therefore did not have the appropriate clothes and or resources to maintain warmth. So like most things, there's different levels that we just went through. So with mild hypothermia, people may hyperventilate. They might start to breathe faster. Their heart rate may increase, and that's the body's desire to pump the warm blood that's in the core of the body to all other organs and body parts to warm up the body. You might start having some mild difficulty with balance, slurred speech, impaired judgment, some things that could actually mimic a stroke. And then again, with mild hypothermia, people generally have that shivering response that's intact. As you get into moderate hypothermia, a lot of these things kind of reverse. So your heart rate slows down. It's kind of lost that ability to compensate. And you just have more central nervous system depression in terms of confusion, and you can start having cardiac arrhythmias, and you can actually have neurologic findings like a depressed pupil reflex during moderate hypothermia. With severe hypothermia, you can have things like coma, really decreased heart rate such that the blood is impaired flowing to the brain, and a loss of blood pressure, and actually have cardiac arrest, meaning that the heart stops beating, and these things would lead to a pretty rapid death. So in terms of what are the causes and potential contributing factors to hypothermia, the geriatric population is certainly at risk. They have a decreased physiologic reserve to compensate for changes in temperature. Certain chronic diseases, again, diabetes, if there's autoimmune diseases, metabolic diseases, endocrine diseases, they can all make you at risk. And a lot of the elderly folks are on medications that blunt the body's normal response to hypothermia. So as we discussed, the body's heart rate wants to increase. It wants to pump warm blood throughout the body. And a lot of medications that are used to treat blood pressure not only keep the blood pressure down, but also decrease the heart rate from getting above a certain point. So that combination of your body not being able to have the appropriate response can exacerbate the symptoms and make these folks who are on those medications at risk. Other medications like diuretics, Lasix, there's a whole bunch of different diuretics that we use to treat heart failure or even hypertension. They can cause dehydration, decrease in blood pressure, and increase the risk for hypothermia as well. Outdoor exposure is certainly the most common place to develop it. Submersion as well. So if you fall through ice and become wet, that's going to really increase if you stay in the water, that'll decrease your temperature rapidly. If you're able to remove yourself from that environment, you can still have the ice that forms in your clothes. And if you're not able to get into dry, warm clothes, that can exacerbate and cause hypothermia to increase pretty rapidly. We discussed the medical conditions and medications as well that can contribute to hypothermia. Pediatric considerations, children and infants are at a greater risk than adults. They have a larger ratio of surface area to body mass, meaning that their body, based on its size, has the ability to lose heat pretty rapidly. Real young ones don't have the ability to shiver, so their mechanism of heating themselves up is not developed. And then again, as we mentioned earlier, depending on the age, they may not be able to identify that they're in a cold environment that's actually causing bodily harm, because either they're just way too young or they're distracted doing other things and don't realize that while they're out there doing these activities that their core body temperature is dropping. Some certain common scenarios to be considered with the pediatric patient population would be runaway children or lost children if someone's out hiking and the child gets lost, near drowning and immersion during cold temperatures, mountain accidents. So again, if you're out there hiking or cross-country skiing or riding an ATV or sledding, anything like that, and there's an injury and leads to prolonged exposure, could lead to hypothermia. And intoxicated adolescents that become incapacitated outdoors. This isn't unique to adolescents. This could happen at any age. The combination of alcohol is dehydrating and then also affecting the cognitive abilities to remove oneself from the environment are all impaired that lead to increased risk of hypothermia. The treatment for hypothermia is first and foremost is removing the person from that environment. Sometimes easier said than done. If you're out in the woods hiking, that's not usually an immediate option. But if you're in and around homes or warming stations, to bring the person in is really important. And then again, I think what's key is if you're out hiking with someone or playing outside and you know, it may be as subtle as the patient, they seem a little confused or their speech is hard to understand. These would be things that would be very concerning and again, mimic a stroke. And those would be people that you'd want to get indoors and then they would need to seek ultimate medical attention. Again, removal of any cold and wet clothes to dry and then dry off and then have warm clothes placed is really important. And any use of external warming methods such as blankets would be important. And, you know, if someone comes to the emergency department with hypothermia, we do have what we call warming blankets as well. We can use things like warm IV solutions to infuse into patients that would warm up their body temperature. And then there are certainly more dramatic ways to warm up people medically, which would be basically putting them on like heart bypass that would warm up the blood and circulate warm blood through. That's extremely invasive, but there are different ways for us to intervene beyond what you can do at home. Great. I don't see any questions. And again, I'll check that periodically. So if you have a question, please feel free to post it there and I'll take a peek. Carbon monoxide poisoning. So this is something that we all just really need to think about and consider. So carbon monoxide, it's odorless, it's colorless, it's tasteless, it's a non-irritating gas that's formed from hydrocarbon combustion. And because it's has all of those features, it makes it very, very difficult. It's impossible to detect if carbon monoxide was in your area. What carbon monoxide does is, so hemoglobin is the molecule in our blood that carries oxygen, and it carries oxygen to all of our tissues, to our brain, to our heart, everywhere. What carbon monoxide does is it binds to the hemoglobin such that oxygen cannot bind to the hemoglobin, and it binds very tightly and strongly, and it grabs onto that hemoglobin and it does not want to let go. So what that means is you're basically, depending on your carbon monoxide exposure, you're basically suffocating all of your organs and your tissues as the carbon monoxide molecule replaces the oxygen molecule on the hemoglobin, and your body is pumping around the blood with the hemoglobin containing the carbon monoxide. And that means that, again, there's no area for the oxygen to be transported around. And so your organs are basically starved of oxygen, which is obviously critically important to maintain the health of your organs. So fire-related smoke inhalation is responsible for the most cases of carbon monoxide poisoning. We can see that certainly with house fires. Candles put a risk to things catching on fire during the winter months. They look nice, but they're extremely dangerous, and not uncommon to have teenagers light candles in their rooms or wherever, and they're a big risk. And carbon monoxide would be generated from a house fire. And so certainly the inhabitants would be exposed to carbon monoxide poisoning, and the firefighters who come in to fight the fire can also be exposed to carbon monoxide if they don't have the appropriate protective gear on. Non-fire related carbon monoxide poisoning is responsible for up to 50,000 emergency department visits per year and around 1,200 deaths per year. And of those 1,200 deaths per year, 800 of those are deemed to be intentional. The car exhaust, which produces carbon monoxide, is a way that people often choose to harm themselves, and that would be classified as an intentional exposure. And those folks, if not found in a very short period of time, can die from that exposure to carbon monoxide. Common toxic things that are out there, and it is most common during the winter months, particularly in the cold climates. Especially when you have things like power loss due to snow or ice storms, which in this area is not uncommon, as we all know. And what happens when we lose power is we all grab the things around the house that can generate heat, generate power, generate warmth, whatever it is. And unfortunately, a lot of those do produce carbon monoxide. And again, if well vented and the rest of it can be a-okay, but this is where we see risk to the population. And so again, we've talked about house fires. It could also be from a wood burning stove, or fireplace. If there's poorly functioning heating systems, again, this is obviously with power, that can cause carbon dioxide release into the environment. And if you have improperly vented fuel burning devices like kerosene heaters, charcoal grills, camping stoves, gasoline powered electrical generators, and motor vehicles running in poorly ventilated areas. So I guess things like a Zamboni and an ice rink running for prolonged periods of time, or cars or trucks in warehouses or parking garages. All of these things produce and create carbon monoxide, and can certainly release that into the atmosphere, and if not well ventilated, can lead to elevated levels of carbon monoxide and the detrimental effects of carbon monoxide and carbon monoxide poisoning. And again, I think whether it's a charcoal grill, a camping stove, kerosene heaters, these are things that people bring into their homes during power outages to generate and put monoxide poisoning. The other thing about that is, if you do have a carbon monoxide detector and it's dependent on electricity, it may not be working during this time, so it will not be there to protect you and give you the notice that there is carbon monoxide in the environment. So signs and symptoms of carbon monoxide poisoning, they're very vague and variable, and it can make the diagnosis very difficult. And so if someone had a slow, low-level carbon monoxide leak in their home, they could be suffering from these signs and symptoms, and it could be very difficult to diagnose this, because some of them could appear like a viral gastroenteritis or a viral respiratory tract infection, and headache most common, and we see headaches in general a lot. There are a lot of people who suffer from all different types of headaches. That's one of the most common symptoms of carbon monoxide exposure / toxicity. And then it can be general things like nausea, dizziness, malaise. As the levels get higher and the exposure longer, people can have confusion, and ultimately things like coma and a seizure. Cardiac injury is also quite common. So with carbon monoxide exposure and toxicity, can cause direct damage to the heart. Again, you think about this as a blocked blood vessel in the heart. It causes a heart attack because the oxygen cannot get to the muscle. Again, as I mentioned, with this hemoglobin molecule circulating through your bloodstream, if it's carrying carbon monoxide and not oxygen, it's a comparable event where the oxygen is not getting to the heart muscle and can cause chest pain and things like a heart attack. It's also why you have the confusion and the coma and the seizure, the neurologic symptoms, because again, oxygen is not being delivered to the brain as it normally is. Can also develop things called delayed neuropsychiatric syndrome, which people who have bad exposure to carbon monoxide can lead to lifelong deficits like cognitive defects, personality changes, and even things like movement disorders. So the diagnosis and treatment, so again, can be very difficult. Most people who, who present to the emergency department have a known exposure. So we would see firefighters who are fighting a fire and come in with headache and nausea and dizziness afterwards. Pretty easy to put 2 and 2 together with that. Certainly suicide attempts with cars running. If they survive to the hospital, we can put 2 and 2 together. And again, so a lot of times we're able to put the history together with the symptoms, but it is important to obtain that history. Otherwise, we might completely miss it. And then again, if there's a low level leak in someone's home, they may have those symptoms, and it may be very difficult to diagnose that it's actually from carbon monoxide. What we can do is check a blood level of carbon monoxide, and actually there are finger kind of probes that can give us a ballpark idea of the carbon monoxide level as well. And if there's a known leak, the first thing to do, so if you're at home and your carbon monoxide detector goes off, the first thing to do is remove yourself, others, and I would say pets as well. So any living person or thing in that environment, you want to remove them from the known carbon monoxide leak. To seek fresh air is really important, because the treatment is actually oxygen, and what we're able to do in the emergency department is high flow oxygen. So like this lady in the picture here wearing this oxygen mask, we're able to deliver basically 100% oxygen. And so what happens is that oxygen enters the bloodstream, and it essentially kicks off the carbon monoxide molecules, or there's more oxygen in the blood to compete for the hemoglobin, so that the hemoglobin cell molecules can circulate and deliver more oxygen to the critical areas like the brain and the heart and the other organs. On the bottom right here, this is a woman who's actually in a hyperbaric oxygen tank, we'll say. This is the physician who is calling in on the phone to actually communicate with the patient. It's a long tube, and what it is able to do is basically to pump oxygen into this chamber and produce oxygen at a very, very high level under pressure to the patient, and actually physically force the carbon monoxide off of the hemoglobin molecules and replace it with oxygen. And that's reserved for people who have very extreme, severe signs, symptoms, and exposure to carbon monoxide. So, prevention, the major point here would be to have a functioning carbon monoxide and smoke detector. Some of them are built as combinations, some of them are independent, but certainly every home should have both of those. And it's nice always to have an annual check of the batteries on those to make sure that they are functioning. If you don't have one should get it. And then again, the plan is, if that goes off, to remove yourself from the house. Generally, you can call the fire department, and they can come in and do a carbon monoxide level check to see how severe the leak is, and also to confirm that there is in fact a leak. And if so, then it would simply, if you're asymptomatic, it would mean not re-entering the house until the source of that leak was discovered and remedied. And if you were found to have symptoms that were beyond mild, to come to the emergency department, where a level could be checked and high flow oxygen could be delivered as needed. And again, it's always nice to have battery backup if the alarm is hardwired. So if you lose power, you do maintain that functionality of the carbon monoxide detector. Okay, great, thank you. So slips and falls. Again, having been here since 2003, there have been several years over the years where we've had just horrific black ice. I think it was usually like a Sunday morning in the middle of winter, and people getting up and going out and slipping and falling and breaking their wrists or ankles. So we not infrequent at all, and goes back to sort of knowing your environment. And sometimes it's just waiting till later in the day till it warms up a little bit to see where the ice gets reduced, or again, just being in well-lit areas so that you can see and notice ice if it is out there. Exercising, lots of people in this area exercise, which is fantastic. During the winter, it's usually quite dark in the morning when we're out driving to work and or coming home from work. So one thing is, if you're outside exercising in the morning or the evening, to certainly wear reflective gear that is easy for cars to see. Certainly wearing a headlight or whatever it takes to increase your ability to check for ice or potholes or irregularity in the pavement that you're running or walking or jogging on is extremely important. And then, as discussed earlier, in terms of frostbite and or hypothermia, to make sure that you are dressed appropriately for the elements. So knowing the temperature before you go out, and dressing appropriately, and particularly having that wicking layer on that pulls the moisture away from your skin to keep it dry, and then a layer of warm clothing. Black ice, we mentioned, certain specific sports unique to the winter. Skiing, we see patients who are brought to the emergency department, on a Sunday evening from Vermont or New Hampshire or wherever it was that they were skiing, with wrist fractures, ankle fractures, all sorts of different things. And ice hockey is a very competitive, very common and popular sport in the area. A high contact sport can also lead to specific injuries that we take care of in the emergency department, mostly orthopedic type. And then car accidents, again, whether it's black ice or snow or just slippery, it's not uncommon to see folks in the emergency department after they have a car accident. Shoveling. So shoveling is a very physically demanding, exertional practice. And so just a warning of caution to the folks who are not out exercising frequently, who may not be in great shape, who do not have regular doctor's appointments, or do all of those things, and to have known cardiac risk factors. We just need to be aware that it can be heavy wet snow can be extremely exertional and can cause things like chest pain and even heart attacks. So certainly have a low threshold to hire the neighborhood kid to shovel your driveway or get someone else to do it for you. If you are to do it, do small amounts with frequent rests. If you're going to get 12 inches for the day, go out there every few hours and do the 2 inches at a time versus the 12 inches of heavy wet snow at the end of the storm. And those things can certainly decrease the risk of one having an untoward outcome due to the exertion caused by shoveling. Also, it's advised not to climb on the roof to shovel snow off of the roof. We've had folks who have slipped off of the roof and injured themselves. And if you're out there and you have to do it, if you're developing shortness of breath, difficulty breathing, chest pressure, chest tightness, that is certainly the warning in time to stop doing what you're doing and get indoors rest and certainly seek medical attention. So fireplace safety and candles. I love having a fireplace. I love using the fireplace. It can be very fun and nice if done appropriately. One thing, just on occasion, I think it's annually that we're supposed to have our chimneys swept. If soot is built up in the chimney, that can lead to a chimney and ultimately a house fire. So important to keep in mind. Should never leave a fire unattended. If there are, and there should be, at least screen and glass doors to keep the fire inside, those should be closed. And especially if you're turning away for a short period of time, you want to keep those embers inside the fireplace and not have them shoot out onto a flammable carpet and or floor. It could certainly be a disaster. The fire should be used appropriately, which would be to burn wood. We should not be throwing trash or other household items to get rid of into the fire, as that can certainly cause a fire that would get out of control in a hurry. Always a good idea to have a fire extinguisher in the house, whether it's for the kitchen and or a fireplace. And, review the proper disposal of soot and embers. You definitely do not want to put active embers into anything that's flammable. You'd want to have a metal container for things like that, and usually best to wait, to the next day or before you go to light your next fire. That's a good time to get rid of the soot and ash, as at that point it will have completely burned down and there would not be any burnt embers left in there that could cause a house fire. The glass, when you have it closed, can get extremely hot. So just as an awareness for if you have kids and or pets, and you may actually even put a little gate around the fireplace so that they cannot come in direct contact with the fireplace. And, very common now are the gas-controlled fires, which are great and easy, but they are fires and can cause the issues that we described above, and some have remote controls. And so if you have young children in the house, you certainly want to make sure that those remote controls are always up and out of the reach of children so that they don't accidentally turn it on in your absence and cause problems. Like open fires in a fireplace, candles can be extremely hazardous and cause house fires and damage, as we discussed before. If you're able to replace candles with open flames with light bulbs that now appear to look like an open flame, that would be advised. But we do see on occasion people who light candles in their room and it gets caught on the curtains, catching fire, or gets tipped over or left unattended, can certainly cause a major problem. I will also just mention depression this time of year, during the winter, during the holiday season. Many reasons that people, can be reflecting on their current and, historical life events, which can lead to things like depression. And then also winter in and of itself, there has a seasonal affective disorder component to it, where there is a known seasonality of depression during the winter months. I think also with the pandemic and COVID right now, which has disrupted many of our lives in many different ways, excuse me, people may have a baseline of depression because of that, because it impacts our lives so negatively, that then if you throw in the things with decreased amount of sunshine throughout the day, unemployment, disruption in life with school, work schedules, whatever it is, really makes an environment that depression can be quite prevalent. Some signs and symptoms of depression: depressed mood, loss of pleasure and or interest in things that otherwise interested you, change in appetite or weight, and that can be, increase in appetite or a decrease in appetite, with weight as well. Sleep disturbances, just a loss of energy, feelings of worthlessness, and can actually lead to things like suicidal thoughts. So I think that this is something for us to be aware of for ourselves, but also for others that we interact with, whether it's family members and or coworkers, just to have our radar up, to check in with one another, check in with ourselves to make sure that we're feeling okay. And if we have signs or symptoms of depression, to be able to seek help and treatment. The winter is also a time when we see peaks in respiratory viruses, primarily things like influenza, and now we have COVID on our hands. Fortunately, some of the measures that we use to prevent transmission of the flu will also help with decreasing the transmission of COVID. So the basic things like hand washing, now wearing masks more than ever, social distancing, staying home if you're sick versus going to work and trying to stick it out. All of those things will hopefully help us temper this winter as we're getting into resurgence of COVID, and again, about the time of year that we start seeing a spike in the flu as well. Influenza obviously has the ability to currently vaccinate, and so vaccination is encouraged, and that's a discussion you can have with your physician if there's any questions or comments about that. And it sounds like in the not too distant future, we will have vaccines hopefully for COVID that will help temper the transmission and surge that we're seeing in COVID. Whether it's the flu or COVID or any other virus, whether it's respiratory or GI, most people do perfectly fine staying at home, getting their rest, making sure that they stay hydrated with fluids, and taking fever-reducing medications like Tylenol or Motrin. when someone has things that can no longer be managed at home, then medical attention being sought is the appropriate thing to do. Certainly if you had any difficulty breathing, if there's a GI component where you had nausea, vomiting, diarrhea, that you're worried about getting dehydrated and you needed to have IV fluids, those would all be reasons to seek medical attention. A couple of things that just the final thoughts are: preparation is particularly in this area with snowstorms, ice storms, loss of power. I would recommend that if you're on medications, chronic medications, to certainly have at least a week's worth of medications at home in case you cannot get to the pharmacy to renew it because whether there's trees down or there's a snowstorm, you don't want to run out of medications that you're taking on a daily basis during a snowstorm. So definitely have a week's worth of medications. Also a nice time to think about and reconsider the buddy system. So know who your neighbors are, make sure you have their contact information. If you know that they have health problems or are elderly, just to check in with folks periodically makes a lot of sense. Times like this, we can really come together and help one another out as needed. And, what we've seen with COVID, and this has been going on now for some quite time, is overall a decrease in visits to the emergency department. And, there's some very time-sensitive illnesses like a stroke, a heart attack, sepsis with a major infection, things like abdominal pain, it could be appendicitis or other things. These are very time-sensitive illnesses where interventions, if they don't occur within a timely manner, can lead to a much worse prognosis and outcome. So, I encourage anyone who's having any signs or symptoms of anything like this, you've got to come to the emergency department and let us take care of you in a timely manner. Just a couple of little things that we've done in the emergency department to make it as safe as an environment as possible is, first of all, everybody entering the hospital has to have a mask on. If they do not, we'll provide them with a mask. This is the entrance, the triage entrance to the emergency department. You can see the yellow stickers. So those are our 6 feet visual cues to help maintain social distancing. We've put up plastic and or glass barriers between patients and staff as much as possible to decrease transmission and to protect both our patients and our staff. We try to utilize individual rooms in the emergency department as much as possible, and the vast majority of our rooms are individual rooms. And then again, we have all the appropriate PPE or personal protective equipment that we need to protect ourselves and any of our patients that come in. So we are confident that we are providing a safe environment for the care of our patients, and we are open 24/7, and we encourage anyone who has any concern about their health to feel safe and comfortable to come to the emergency department for evaluation. So that's it. Again, I think we covered a bunch of different topics that are usually unique to the winter. And hopefully this was informative and educational. And my parting message would be just to remember that if there's any question or concern, at a minimum, call your physician and they can give you guidance. But we are here in the emergency department 24/7 to provide safe, timely care. And again, there are some illnesses that are very time sensitive that we can do things within a certain time frame, but after a certain time frame, our interventions decrease, which can lead to worse outcome. So you certainly want to err on the side of coming to the emergency department to be seen. So I thank you all for your time. I don't see any questions, but I spend most of my time here at Greenwich Hospital in the emergency department area, so you can always reach out to me. And I thank you for your time, and I wish you and your family and loved ones a very safe and healthy winter and new year. And take care of yourselves and be well. Thank you. Thank you, Ms. Lipman. I appreciate the opportunity, and I hope you all have a great day. Thank you.